During this video, we'll explain how breast reduction surgery is done. During a breast reduction procedure, excess skin and breast tissue is reshaped or removed, and the remaining skin is tightened. Also, large areolae may be reduced in size and moved to face forward. Your surgeon will assess the size of your breasts to determine the type of breast reduction procedure that is best for you. The scar length and position will depend upon your breast size and degree of sagging. There are a number of basic breast reduction techniques. The anchor or inverted T technique involves an anchor-shaped incision that extends around the top of the areola and across the lower portion of the breast. The vertical or lollipop technique involves a V-shaped incision that extends around the top of the areola and down the midline of the breast. Liposuction can also be used alone or in conjunction with these techniques. This can help reduce further fat from the breast. During this animation, we'll demonstrate the vertical technique. Before the procedure, your surgeon will use a pen to draw incision guidelines on your breasts. This is your final opportunity to discuss scar length and position with them. Ideally, you should discuss this in detail well before the day of surgery. To start, anesthesia will be administered. This procedure can be done with general, regional, or local anesthesia. Full details will be included in the written consent information. It's a decision between you, the surgeon, and the anesthesiologist, depending on your personal requirements. You'll be placed flat on your back on a special soft mattress. The surgeon will make an incision or cut along the pre-marked lines. Excess skin and breast tissue is removed. The nipple and areola are slid into their new, higher position. The breast tissue is tightened and lifted using sutures or sometimes a mesh for extra support. The new edges are brought together to form the outline of the new breast contour. This will be done to both breasts, and the surgeon will examine and make alterations to achieve symmetry or as close to symmetry as possible. When satisfied, the incisions will be closed with sutures. A surgical drain may be left inside each breast to drain away excess fluid. Dressings will be applied to protect the wound. You may be fitted with a compression dressing or bra to protect the breasts while they heal. You'll get personalized post-operative instructions on drain and suture removal. The whole chest area may be bruised, swollen, and discolored over the first few weeks. In time, this will settle and the incision lines will fade. However, it's important to realize that there will be permanently visible scars. There may be some pain or numbness near the incision lines. You may continue to notice a change in the appearance of your breasts as swelling decreases. It may take up to 1 year before the final results from your procedure are apparent. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team.